COVID concerns continue to mount in the nation. The active case tally has surpassed 3,700. Highest number of cases continue to be reported from Kerala, where the new variant JN.1 emerged. Now, in the latest, Maharashtra has reported 50 new COVID cases. Out of these, at least 9 are JN.1 variant cases, which is seeing a massive surge now. Now, the total JN.1 COVID cases have risen to 10 in Maharashtra. The Shinde government has instructed health officials to ensure the availability of ventilators, oxygen cylinders, and other necessary equipments at all the government hospitals. However, the centre is trying its best to allay the rising concerns. Union Minister of State for Tourism, Shripad Naik, has said that citizens and the tourism industry need not worry about the latest wave of COVID-19, as the country has fought the disease in the past. Now, earlier, the World Health Organization had declared JN.1 as a variant of interest. The World Health Body has asked countries in the Southeast Asia region to scale up surveillance protective measures, as it reported a 52% rise in cases globally. Let's go across to my colleague Ishika, who joins us live from the national capital. Ishika, there's a concern about the recent surge in COVID-19 cases. Now we are learning that also the World Health Organization has asked the South Asian countries to amp up the surveillance. But as far as the advisory is concerned, the state-wise advisory is concerned, what all are you gathering in from the national capital?
Well, certainly, Simran, after the uptick in the number of COVID cases, there is certainly an alert all across the country. If we talk here in the national capital, certainly, if we compare it to the other states, the number of cases reported daily are very few in number. In fact, as per the data also that was released by the Union Health Ministry, the number of beds that are occupied by the COVID patients in Delhi hospitals are also quite low. So certainly here, if we talk about the danger is not as compared to the other states, but still the state government and also the Union Health Ministry is on high alert. If we talk about Saurabh Bhardwaj, the Delhi government health minister, he has in fact, had also done a mock drill of all the hospitals, of all the state government hospitals in early December itself. Also, he has now advised all of the medical centers and the hospitals here in the national capital that anyone who comes with flu-like symptoms should also be tested with COVID-19 tests. Now, not just that, he has also asked the hospitals that, all the RT-PCR positive samples, genome sequencing should be done of that. Now, he had also asked for the, data from the Union Health Ministry as to how many COVID cases are reported here, so that further guidelines can be made on that. Now, certainly, the experts at this moment say that there is nothing to panic as of now here in the national capital, but the people need to be on alert. As soon as, the cases increases, the people should start, practicing all those measures that we used to do, so far as the lockdown goes, be it the sanitization of hand, wearing of masks, so that, the further spread can be prevented. So certainly, at the moment, no danger as of now in the national capital, but as the cases increase, guidelines is also expected from the government side. Over to you.
All right, Ishika, I appreciate you joining us live from the national capital and giving us an insight on the COVID advisory from this day. And for Mumbai, let's go across to my colleague Shweta, who joins us on the phone line. Shweta, 50 new cases have been reported from Maharashtra. Help us understand the situation on ground, because the government is also taking up all the measures to ensure that the government hospitals have all the facilities ready.
Well, that's correct. In fact, 50 new COVID cases have been recorded in the state of Maharashtra. And apart from this, what we understand is that the new subvariant of Omicron, that is JN.1, the total tally in state of Maharashtra has risen to 10, as 9 new JN.1 cases have been recorded across the state. Here, if we just segregate, we find out through the official data is that 3 has come from Pune district, that is 2 from the city, 1 from rural, 1 from Akola, 5 new cases from Thane, and the one previous case, which is from the Sindhudurg district. So total in 10, we have cases of JN1. Here we understand that, however, the health officials have also suggested people and they have advised people to make sure that they are following COVID appropriate behavior. Apart from this, no stringent guidelines have been given for the state or for the city wise. Here it's more important to understand that because JN1 is quite transmissible in nature, they have been increasing from the official side and the government side. They have been ramping up the testing, tracking, and apart from this, in the hospitals, genome sequencing is one thing which they have been ramping up. Here, just few days back, in fact, the Health Minister of Maharashtra, Tanaji Sawant, also gave the report on the number of beds, the oxygen cylinders availability, and the genome sequencing labs which are available in the state. As of now, what we understand is that this is not a situation to panic, but certainly to follow COVID-appropriate behavior.
Right, Shweta, as you correctly pointed out, that it's not a situation to panic, but to take precautionary measures. On that note, I appreciate you joining us live with us.